Okay. All right, so I'm going to talk about developing discrepancy. So I'm not going to go into all of the ins and outs, repeat again about motivational interviewing. I will highlight a few concepts that are necessary to understand where we're coming from. But hopefully everybody has some kind of background, which actually I'm going to ask you about in just a few minutes. Some of you may know that I've been training people in motivational interviewing for quite a while now. I've been a member of the Motivational Interviewing Network of Trainers, the MINT, for about 4 years now, although it seems like longer sometimes. But I've been training before that. So that was just getting more, I guess, kind of credibility that I had to jump through a bunch of hoops to become a member of the MINT. And I teach undergraduate social work at Southeastern Louisiana University. And then I teach part-time MSW courses for Walden University, which I've been doing that for 7 years now. Before that, I was in practice. I'm a licensed clinical social worker, and I worked in a variety of settings, quite a bit in addictions is one of my primary areas, community mental health, and juvenile justice and corrections. So I will go over just a little bit about motivational interviewing, but I'm going to focus on jumping to talking about the stages of change and how that fits with Miller and Rolnick's concept of motivation. So motivational interviewing isn't a comprehensive theory of change by any means, but it fits nicely with the stages of change. So I'm going to talk a little bit about that because that's going to help us understand what we mean by developing discrepancy and how we can talk and respond to people who don't seem ready for change. So we call that sustained talk. People with low problem recognition. So I'm going to, talk about some strategies on how to address that sustained talk, how to respond to it, and then strategies to try to get them past that low problem recognition. So now I'm going to ask for the poll. Let's see if I can get to it. Actually, I think I can. So I'm going to launch the poll. And so you should be able to click on your screen there. When was the most recent workshop, seminar, or webinar you attended on motivational interviewing? It doesn't necessarily have to have been mine, but just how recently have you had some kind of information about MI? Okay, it looks like most who wanted to respond responded. Here, let me end the poll, share the results. Okay, so it looks like at least half of you have had fairly recent training, so that's good, and even in the past 3 to 6 months. So if it's been a little while, so I do have a percentage of you who may have been a while, and fortunately it's only maybe a couple people who haven't had much at all. Just like I said, do feel free to ask any questions if maybe something isn't clear, and some of it just may become, to be honest, becomes more clear the further we kind of get along in this particular training. But I will at least start with one of the definitions of motivational interviewing, just to give you an idea of what it is. And so motivational interviewing is a collaborative, goal-oriented style of communication. So it isn't just a counseling approach that I've taught a lot of paraprofessionals in this particular approach as well. And so it is really a way of being with your client, that it is very much about working with them. And it's kind of that humanistic kind of approach where, you believe in their ability to change and what they bring to the table. But it is still goal oriented. There is a direction of change that we want people to move in. And we pay particular attention to their language of change. So client language has actually been researched, and I'm going to talk a little bit about that here in just, I think, on the next slide. And this approach is intended to strengthen a person's own motivation for and commitment to specific goals, to a change. And we do that by eliciting and exploring their own reasons for change. So it almost sounds like motivation interviewing sounds like, motivational speakers, right? That's not what this is. It's not the same thing, right? The idea is that we help the person to bring it out of themselves and develop it within themselves. And we do that in this way that is not overly directive. It's still very guiding, but it isn't that we are trying to make them change. We are just helping them feel safe enough to explore the change and make a decision for themselves. So we do that through acceptance and compassion, that our way of approaching them and being with them must be very accepting. And I'll talk about that too in a little bit. So some of the research, I'm not going to bore you with a bunch of research, I promise. I just have a couple slides here that sums it up, because this is the point of motivational interviewing, that research on client language, looking at change talk and sustained talk, which I will define here in just a little bit, that when the therapist or counselor consistently used motivational interviewing type skills, there was more change talk, but not always less sustained talk. So that's kind of a problem. So people would talk about change, but they still made excuses. However, when people did not use MI skills consistently, there was less change talk and actually more sustained talk. So that's more excuses. It was more about why they don't want to change. And really what they found is that it's not so much the amount of change talk that predicted the outcome as much as the sustained talk did. So the more sustained talk they had, the worse the outcomes. So this tells us that, and we're still doing more research on this in motivation interviewing, because we're trying to really understand more about the role of sustained talk now that we realize how important it is. And that's really what this particular session is about, is that we have to figure out a way to help clients talk less about their excuses to not change. So what we do know also is that being very empathetic, using very good complex reflections can reduce that sustained talk. And low levels of empathy actually may be kind of harmful. So meaning that if we don't, empathy isn't just about you understanding the client in your own mind, it's how you express that to the client, that you help them to better understand themselves through those kind of empathic skills, which is reflections and good open-ended questions and affirmations. So we'll talk about that during this session. So now I'm going to go to the stages of change. And so this is Prochaska and DiClemente's trans-theoretical model of change, basically, right? That's the fancy word for it. So stages of change, hopefully many people have typically heard about this, at least somewhere in your career, and that this is, one of the most common, change theories that's out there. And so what they've described is really more of a cycle. So I listed them there on the left, but it really is not a close-ended process, right? That people move around. It's really more like a circle. And so, you at some point you started out though with pre-contemplation, meaning, this isn't a problem. So I'm not thinking about whatever the behavior or issue is not a problem. We move to contemplation when we begin to think about it and think, well, maybe, so this is problem recognition. This is saying, well, maybe, what I really want and the way things are isn't lining up, that something's not quite right. And that's actually the discrepancy that we want to get people to. This is going to be, these two stages are going to be very important. So hopefully the contemplator makes a decision. So sometimes people put decision in this model, but it's really, segue into preparation, that if a decision is made that a change is needed, so that would imply some commitment, right? Then they go to preparation. So they say, well, how am I going to change it then? What's my plan, right? Then hopefully they put it into action. So that's implementing the change. And then at some point, hopefully that change becomes a bit more routine and may require a certain amount of maintenance. Now, at one point, I think this model had it where people might even be able to exit maintenance as if the change is permanent and they don't really need to think about it. But what they find is that's not very accurate, that most people do need to continually try to stay on top of whatever the change, particular change is, that we have to keep mindful in some kind of way in order to maintain that change, or sometimes go back and make some adjustments, right, to however it is that we're changing. So how does this relate with motivational interviewing? Well, as I mentioned, Milner and Rolnick talk a lot about change talk and sustain talk. I think they used to call these something different many years ago, before 2013. I think they used some different terms. But in the past 7 years or so, we've really focused on using change talk and sustain talk. So the change talk is what we want. This is what we want to hear from them. This is how we help evaluate their readiness to make a change. So they make arguments for change, that they have certain types of change talk that tells us whether or not they are ready, willing, and able to make that particular change. So the first part of change talk that we often focus on has to do with, this is preparatory change talk: desire, ability, reason, and need for change. So in preparatory, they might say, I want to make a change. They might talk about maybe a confidence in their ability to make the change. And they talk about reasons to make that change, right? That I need to do this because, or I should do that. Here are the reasons why. And if I don't do it, here are the consequences. So those are all reasons for making the change, sort of the logic behind it. And the need for change is that level of importance, that this is a high priority, something that I need to do now. So usually if they have all four of those, then they might express a commitment or activation for change. So if the client expresses commitment, which is I will work on this, or activation, which is implied commitment, like I'm willing to work on this. So if they're giving you that kind of commitment, then you're ready to move on to planning for change, that they might have even taken steps towards change. So if they're in that area, you don't really need motivational interviewing, right? You're ready to do whatever it is you normally do. But what tends to happen is that the preparatory language isn't complete. Oh, sorry, I forgot how I changed it. So how does change talk fit with the stages, Prochaska and DiClemente stages of change? So if Miller and Rolnick from Motivational Interviewing look at that preparatory language, the activation language, and the taking steps, how does that fit with the stages of change? So what do you think preparatory language, which stage do you think that might fit with? So when you think about what was it, pre-contemplation, contemplation, action. Okay, Sarah, thank you. Contemplation, yes. So what would activation language, which stage of change might fit here? Action, yes, exactly. So that kind of fits. I'm sorry, preparation. Sorry, activation language is preparation. That they say they're willing to, or I will. So that's preparation. They've made a decision. And then the taking steps would be the actual action, that I'm doing something to make a change. Sorry about that. So here's what I meant to say was that, so what we're kind of missing here is that sometimes when people are have the preparatory language of change, it's not complete, as I mentioned, and they also still may talk in terms of sustained talk. So these are the arguments against change, or I just like to call it excuses, right? It's excuses to maintain the status quo. The status quo meaning whatever their current lifestyle is, right? Excuse me. And this does parallel the change talk. So the preparatory change talk was desire, ability, reason, and need. If it's sustained talk, then it would be desire to not change. And it might be a lack of confidence or inability to make the change, or there's the excuses or reasons to not change, or they just simply may see no need for it. It's just not important enough for me to want to work on. So this really is what we're going to be looking at in this session, is thinking about this kind of sustained talk, that they tend to get stuck here, or even completely, you might hear a little bit of change talk, but maybe mostly sustained talk. It could be entirely sustained talk, right? So someone who absolutely will not view whatever the referring problem is not, that they'll view that as not being a problem whatsoever. So that would be, you might use the term resistant, right? Or in denial. So it isn't just that the motivation is questionable, that for some people, the sustained talk indicates denial. All right, I'm just kind of checking myself here, make sure I said what I was going to say. Okay, so now, which stage does sustained talk? So from the stages of change, which stage are we missing here? Which one did I not mention yet? Thank you, Jane. Yeah, pre-contemplation. So sustained talk, when it's a lot of sustained talk, indicates that they might be in pre-contemplation. So remember that in preparatory language, and if they're in contemplation, there's some problem recognition. They still might make excuses for not changing, but they have some kind of acknowledgement that maybe that's something they should work on, even if they don't want to. With pre-contemplation, we're really looking at primarily sustained talk. There might be very little change talk, and they might not be receptive to talking much about it. So in terms of where you are in your process with your client, if they are in pre-contemplation and there's a lot of sustained talk, then ultimately you're kind of stuck in that engagement and focus sort of stage. So the processes in motivational interviewing begin with any client that you want to engage them, right? That you want to listen to their story, you partner with them and ask them what they want to work on and what their concerns are. And that normally you're hoping that you come to a focus, that what is it that they really want to work on right now? And then if they're still not committed 100%, then you might evoke some change talk. So that was the previous webinar that I did. So that was strategies to elicit change talk, and then hopefully start to make a plan for that change. When somebody is stuck in pre-contemplation with a lot of sustained talk, you try to evoke change talk from them, they may not have much to tell you. So they might feel a bit resistant and shrug their shoulders, or just tell you, no, I can't think of anything, right? Or it could just be that they don't say much of anything at all. It's not working, right? So we have to step back and get to the point where there is some kind of problem recognition. So until there is problem recognition and then some readiness to talk about that problem, we can't move forward. You can't get to planning for change. They're not going to implement anything at that point. So the pre-contemplator. So typically they define this as a client or patient who is not currently interested in making a change in the next usually they say in the next 6 months, that they're not interested in it right now and not anytime soon. So why is there sometimes this lack of problem recognition? So there's kind of two main, there's more than this, but these are two main things to think about. One is that they might be uninformed about the behavior, that they don't understand why people think it's a problem. They don't see what's happening. Maybe it's not their problem, that it's maybe society's problems, for example, or the parents, right? Whoever it might be, it's somebody else's problem, but their own. Or it could relate to them feeling actually very demoralized about making a change. So people can feel, this might happen when somebody feels very vulnerable. There is a lack of, confidence in their ability to change, that there's a lack of hope. How could I possibly ever make that kind of change? They don't see themselves making that change. Maybe they don't know anybody who's made that change, right? So there's all kinds of things that lead to that really kind of feeling of hopelessness about the situation. But they may not tell you that, right? So that it comes out in terms of maybe being resistant or acting as if they're in denial, when really the underlying issue is this complete lack of confidence and lack of hope. So the next webinar I'm going to do next month, and the last one at this point, is that I'm going to talk about how to help clients develop hope and confidence. So that'll be a separate one. But someone who say, okay, Margaret, we'll kind of define it, that if someone is, say, is part like of a vulnerable population, so someone who is, say, low socioeconomic status, low education, and lives in a high risk kind of neighborhood, and let's say it's a woman who is struggling, doesn't feel safe, is struggling to make ends meet, and child welfare is called. And so she gets involved with the child welfare system, where they feel like she is abusing the children or neglecting the children. And she's supposed to go to, the whole, like, go to rehab and go to parenting classes. And she's feeling like she's just being blamed, that it's really not all her fault. And how is she supposed to do all these things when she has no resources? and low education. So she might feel demoralized, like society is looking down upon her as being wrong or bad. And therefore there's no way she could possibly change. That's a very self-defeating kind of feeling. I hope that helps. So in either event, whether it's just being uninformed and or feeling demoralized about changing, they will typically avoid thinking about it, right? That they don't want to read about it, talk about it, think about it. So they do often come off as resistant or being considered unmotivated. So let's do the other poll here. And so what I'm going to do is ask you how you might approach this person. So hang on, let me get my poll up. Is the other one up here? Lindsay?
Yep.
I see it. Sorry. Okay, I see it. It took me a second to figure out what I had to click on. Okay. So if the client says, I guess I'll try going to NA, Narcotics Anonymous, it just seems like it will make me want to use. So how might you respond? Either, what do you mean by makes me want to use? Maybe you tell them, maybe you haven't found the right meeting yet, and try to reassure them. Do you ask, what leads you to agree to try it now? Or the last one, you're more open to the idea now. What led you to decide to try it? Just about everybody voted that wanted to vote. I kind of wait. I can see it ticking, so I just sort of wait for it to kind of slack off a little bit. All right, almost done. And I think if some of you are on the phone or might have trouble getting to it, I understand that. All right, 80% response. That's pretty good. I'll take that. Okay, so it looks like most of you did choose, you're more open to the idea now. What led you to decide to try it? And that is ideally the best answer. So what's the difference between, let's look at that first one. What do you mean by makes you want to use? Which is an open-ended question, right? So that fits that aspect, that skill, but it's the intention that we use these skills with that really matters in motivational interviewing. So how is this one just a little bit really is more appropriate than A? Let me go ahead and stop sharing this one. We'll look at, because I have them right here. Yeah, so why is D better than A? Okay, thank you. Jane says, helps elicit more change talk. Yes. So this is exactly what we're talking about with understanding the difference between change talk and sustained talk. Now, sometimes people give information, clients know everything they say isn't either change talk or sustained talk. There's other neutral, information stuff that comes out. but trying to discern all of that is important in motivational interviewing. So when you see, and this is like kind of a classic ambivalent statement here, is that it doesn't sound a lot like change talk, but it's something, and we have to find those little, needles in the haystack, so to speak, that I guess I'll try going to NA is a little bit of change talk, right? Even though it's tentative, but we can build on that. Whereas it just seems like it will make me want to use is the excuse. That's sustained talk. So if you ask them, well, what do you mean by makes me want to use? Then they're going to they're going to talk about why they don't want to go to NA. And then you tend to be, you as the provider are usually inclined to respond to that sustained talk by explaining to them why that might not be a very accurate assumption to make. So now you are trying to convince them that they should try NA. Whereas if we start with, well, wait, what's got you open to it now? So it might not be, highly insightful, but it's definitely going to lead more to the change talk. All right. Okay. So the issue that here's what we have to worry about when we are dealing with these pre-contemplators is that it's very easy to increase resistance from them, to not engage them in the treatment or counseling process. So when we do things like try to convince them that they have a problem, if we argue the benefits of making the change, so we tell them how they would benefit from the change. If we warn them the consequences of not changing, here's what's going to happen if you don't change. And when we tell them how they should change, here's what I need you to do. Here's what you should do, right? So when we find ourselves, even when you don't tell it overly direct, like in a directive way, we are still telling someone how to change when we say, have you tried blah, blah, blah? Do you think you might try this? Have you thought about? And so we ask them these close-ended questions that are suggestions, basically, but it's still, particularly with somebody who is pre-contemplative, could really come off as you are trying to tell them how they should change. Richard says, is it okay to ask them about benefits and consequences? Absolutely, yeah. And I'm going to talk about that too in a little bit, because sometimes even when you ask them, well, what do you think might be the benefit of doing this treatment? They might say, I really have no idea. I don't know why I'm here. Then you can share with them. Then you say, well, a lot of people have found X, Y, and Z helpful. What do you think about that? So that's one of the strategies that we'll talk about. But when we are busy trying to be too directive, we call this the writing reflex in motivational reviewing. So that we are trying to make things right, we also call it the fix-it hat. And this is what we want to avoid doing. What I have is some information about some tips to tame the writing reflex by Dawn Clifford. I think I might have used this in one of my other presentations, use this woman, not the same video. So this one is about 3.5 minutes. She's really, I like the way that she kind of sums it all up for you. And let's just take a quick listen here.
We often have great ideas for supporting our clients and patients through the behavior change, but sometimes they really don't need them. My name is Dawn Clifford. I'm one of the authors of the book Motivational Interviewing and Nutrition and Fitness, and a motivational interviewing trainer. And today we're talking about taming the writing reflex. The writing reflex is really defined as any time we notice within our bodies that we desperately have the desire to give information, to provide unsolicited advice. And while there's certainly a place and time to provide some information to our clients and patients within the context of a motivational interviewing session, timing is everything. So tip number one in taming the writing reflex is notice it. Become aware of that desire to give information or to provide unsolicited advice, and breathe your way through it. Notice when it arises and think to yourself, okay, I have some information. I do want to give this to the client. I'm not sure if now's the best time. Timing is really everything when it comes to giving information. You may be in the engaging process or maybe the focusing process when this writing reflex arises, when you start to notice, I have that desire to give information. And it may not be the right time because you're really in that moment of getting to know the client or focusing down to a specific topic and really unpacking it all. And so it may just not be the right time to give the information. So become aware of the writing reflex, notice the timing element. And the third tip I have for you today is remember, before giving information or before giving any sort of advice, ask the patient or client for their ideas. Find out what they've already thought of. Ask them, what they think might work best for their lives or what they already know about a certain topic before giving information. And finally, remember to ask their permission before providing the information or before giving advice. So I might ask, what ideas do you have for how you might go about making this change? Or I might ask, what do you already know about this topic? And then once I hear their response, I might ask, is it okay if I give you some information that's worked for other people? Is it okay if I share with you the latest evidence on that topic based on what the science tells us? And so we're simply just asking permission, demonstrating partnership in doing so. So those are your tips for taming the writing reflex. First, become aware of it, note the timing, truly stay in the moment with the patient or client and focus on listening and not trying to fix. And then when it is time to give that information, ask them for their ideas first and ask permission before providing your ideas. Tame that writing reflex. It means everything in the realm of partnership, giving off that aura or that spirit of partnership towards your patient and client. My name's Dawn Clifford. Thanks so much for watching this MI tip of the day. Please subscribe to my channel and we'll see you next time.
So I just summarized those tips she just gave right here on this slide so that you will have it in your PowerPoint, because you will not be able to view the slides, from the PowerPoint document or it's a PDF that you will receive. So I just want to make sure that you had those. So really, I think the biggest thing is knowing that, and those of you who might be very seasoned kind of counselors, this might be easier for you, that you realize that you try not to give suggestions, that you try to work with the client and you're already pretty good at eliciting things from them. And then for others, it can be really a struggle because, we want to help, and I know your intentions are good, but our intentions need to be focused on how do I help the client help themselves? That it's not always about me having the answers, but that I can guide them towards finding their own answers. So when we're working with these pre-contemplators, these sustained talkers, really what we need to do is focus on developing trust with them. That we need to validate their experience. So, remember, it doesn't mean that you're condoning anything that they've said or done. It just means that you're trying to understand it from their perspective, to truly be in their shoes, and to help them find their own reasons for changing. Ultimately, we are moving them from, no, I won't change, to, I don't know, I guess I can think about it. We can talk about it. So getting them safe and comfortable enough to even begin to talk about it. So we really need to avoid giving advice, trying to fix it for them, because they don't even know that that's something they want to fix at this point. So how do we do this? Well, the first thing I'm going to talk about in these strategies is to essentially they call soften the sustained talk. So how you respond to the sustained talk is the first key piece, and then we'll get to the strategies for developing discrepancy. And so in responding to that sustained talk, that we need to keep the spirit of motivational interviewing in mind. So some of you might remember PACE, and then those of you who it's been a while since you've done any MI training, this is probably new or new-ish. But essentially that, it's important to partner with the client. So that's that collaboration, to ask them what they want, to respect that maybe you have expertise in your area, but they are the experts of their own lives. It's also important to have acceptance, which I mentioned earlier, but I'm going to talk about that in just a moment more. And then compassion, which is the caring piece. And then to evoke. Evocation is that we want to evoke from them, that we're not imparting wisdom upon them by, that's really what we're trying to avoid doing, is that we want them to find it within themselves. So I mentioned acceptance. And I say that because the components of acceptance are really also very, very valuable to dealing with sustained talk. So to demonstrate absolute worth of the client, that's that non-judgmental kind of approach, that you remain kind of objective in a sense, right? Still caring, but objective. So you're not judging their actions or their words. That you respect their autonomy, within normal legal, ethical guidelines, right? But generally speaking, you respect that they ultimately have to make their own decisions, and you affirm them. So you try to find, this is part of especially dealing with the demoralization issue, that you find positive things to say about them, about their efforts, their intentions, just characteristics that you might note about them. And then lastly is to have accurate empathy. So really working on those empathy skills to put yourself in their shoes and try to actually step out of your own shoes before you step into theirs. So letting go of our own biases and to truly try to understand where that client is coming from. Then we also need to practice the core skills. So these are common counseling skills. They don't belong to motivational interviewing, but these are the core skills that we teach in this approach. And that is to use open-ended questions. So I mentioned that earlier, right? That asking questions, what, how, tell me more about that. But also trying to use open-ended questions that get at change talk, to not focus on the sustained talk. We also want to use, so affirmations is not just a principle, but is also a skill. And then I'm going to talk about reflections and some other kinds of strategies in just a moment. So those are really the key ones. Summarization really is, that form of reflections that sums things up and allows you to transition to the next question or area, or wrap up a session, right? There's different ways that we use summarization. But primarily I'm going to talk a bit about reflections and some other kind of similar strategies. So to soften the sustained talk, there are some, first I want to talk about the 3 common reflections that we use in motivational interviewing. So these are by no means supposed to be comprehensive, the end all be all of reflections. But these are some of the more common ones. And so thinking about, just sort of straight reflections. So these could be either simple or complex, that really gets at the content. So let's say, for example, the client says, I'm not concerned about my anger. Then your response might be something like, you have other concerns that are more important. So you see how that one kind of added something to it, that actually we're kind of making a guess that maybe they do have something other than the anger on their mind. So a simple reflection would be, you're not bothered by your anger, right? That just kind of restates what they said. But a complex reflection really adds something to it and does move the conversation a bit. Another one that I use, especially in the when I worked in addictions, was amplified. So this is sort of it's an exaggerated. You can amplify, or you can actually kind of under reflect. But typically, with the pre-contemplator, you want to amplify, and so it kind of exaggerates something that they said, in that you are looking for them to kind of almost push back in an opposite way. It's almost, what do you call that when it's, you're trying to get the opposite. Sorry, y'all, I just totally lost my train of thought. Maybe somebody will get it. My counselors out there, maybe you know what I mean. Paradox. It's kind of a paradox. That's what I'm trying to say. And so let's say the client says, I think things are just fine in our marriage the way they are. And I say, so there's really no room for improvement. So I might kind of emphasize that you're saying that there's nothing to be done, that it's great the way it is. Now, you can't be snarky about it, right? It has to be sincere, but it is a way that hopefully what you're saying is, well, what marriage can't use some improvement, but it's okay the way it is, right? So that's kind of what you're hoping to get from the person, and that I could use that. To me, that's useful. It's like, oh, okay, well then, so maybe then I can use a double-sided reflection from that. So double-sided takes the sustained talk along with the change talk, that both ways, the ambivalence that they're feeling about making the change, and you sum it up. So you're feeling comfortable with the state of your marriage, yet you recognize there may be some things you could work on. So you see, I'm moving it along like, oh, maybe there is something that you could work on, right? And this is assuming that we need to talk about their marriage, right? So remember, this is goal-oriented, goal-oriented. So just assume that this is what we needed to work on. So those are kind of the common reflections. And then we can just use those, or we can maybe combine them with some of these other strategies. And so these kind of take on a sense of reflection, but have another intention to it. So for example, we could emphasize their autonomy. So if the client says, I really don't want to exercise, and I say, well, that's certainly your choice. I mean, no one can make you decide to do it, right? Or I'm not here to force you to do it. Things that say, this really is up to you. This is true even for mandated clients, right? So even though they're mandated, they really do have a choice. Now, they may not like the choices, but they do. So reminding them, but you have to be here, really is not helpful. And they're more likely to rebel against that, rather than saying, well, I'm not here to force you. This has to ultimately be your choice and what you think is best for you. But we can talk about that. So it doesn't necessarily mean that you leave it at that. You can talk and say, well, what would be the benefits of you coming here? Or what if you don't come? What happens since it's mandated? What does that mean to you, right? So we can still engage in processing it, but trying to convince them that they have to come is not likely to work. Another strategy is using reframing. So reframing kind of has a little bit of affirmation meets reflection in it, maybe. So this is, putting something in a positive light, right? So you find something, some sort of silver lining in something that they said, and help reframe it. So for example, if the client says, my wife's always nagging me about my drinking, she really cares about you, or sounds like she really cares, that she's really concerned. You see, like, you put that little twist on it, and it can help reduce certain amount of defensiveness about it. Then there's agreeing with a twist. So this one is where essentially you do kind of nod your head with what they're saying. This is, for sustained talk. And then the twist is that you include something about the cost of that behavior. So for example, the client says, I can't imagine myself not smoking. I mean, it's part of who I am, part of everything I do. And I say, so you just wouldn't be you without it. And it's so important to you that you may have to just keep smoking, even though you are aware of that cost. So again, that's another one that you want to make sure you're not snarky about it, right? It's just, hey, this is what I hear you saying. Okay, trying to be as objective as possible. And I have 3 more for you. So we have another one called the running head start. So again, it's using sort of reflections, but in a way that is sort of just opening up the can of worms, I guess. So let's say they already start talking about not, the client already starts talking sustained talk, something negative. They don't want to be there, for example. This is BS. My probation officer is making me do this. And you jump in and the reflection starts off simple enough. It's like, yeah, so there's some things you don't like about the situation, like being ordered around. And then you kind of like think, this is where you have to use your empathy skills. Like, what else might he or she be thinking? And you just try to throw it all out there on the table. Like, yeah, let's just put it all out there. Here's all of the things that you're going to tell me you don't like about the situation. This is all of your sustained talk, like talking to people about your family matters, and like things being blown out of proportion and other people making decisions for you. That doesn't feel very good. And then hopefully the idea is to just be like, hopefully be able to start to move on from it, right? Another one is coming alongside. This is just like agreeing with the twist, but without the twist. So this one is just saying, you know what, it really might be too difficult for you. This exposure therapy is not everyone's cup of tea, though it's effective, but, exposure means experiencing and getting through the fear, and it may not be worth that discomfort for you. So maybe it is better that you just stay as you are. So you could see where it's really like, again, it's another one of those sort of paradoxical approaches that you use. We used to call that reverse psychology, right? But we try not to say that. But it is like, it's just saying, you know what? You're right, this isn't going to work. And so that hopefully the idea is that they go, wait, that's not what I meant, right? So you're hoping that they kind of push against, kind of like an amplified reflection, right? But this is a specific form of that. And then lastly, you may include refocusing or redirecting. So you might use a reflection and say, I'm trying to remember what I had said on one of those other slides. Give your reflection and then say, well, on the other hand, so you're not really sure you want to be here, you don't like the situation, but on the other hand, how might coming here be useful to you? So you try to refocus or redirect it to hopefully get to some change talk. And then some of these, it's going to be the same with the other strategies, but some of these that we come to this coming alongside, because I'm going to actually mention this one again towards the end, is that this one, you want to be careful when you use it. So it's not one that you pull out right away, right? That this is something that would be one of the last ditch efforts to use. Because obviously the point is they might end up saying, you know what, you're right, I don't want to be here, bye. Right. So you want to try some other things before we just finally say, okay, this isn't working. So here's an example. So the client is a 14-year-old youth. You can say male or female, it doesn't matter. And the youth says, my parents said I have to do this. I don't have a problem with anger. Sometimes people make me mad. That's on them. I'm just defending myself. So how might you respond to this? And one thing that I'm kind of suggesting is that you choose to create a reflection that's either straight, amplified, or double-sided, if you can find a double-sided in that, and then tag on one of those other strategies that I just talked about. So the emphasizing autonomy, reframing, agreeing with the twist, running head start, coming alongside, or refocusing and redirecting. So what I want is for you to think about that and start typing in the chat box. What might you say in response to this youth client? I have a couple of ideas, but I want to see what you guys come up with. So first, think of a reflection. Okay, so Tanya says, I can understand wanting to defend yourself. Good, good. What on the B side column might you add to that? Either Tanya or somebody else. So based on what Tanya said, what else would you add to that? And Tiffany's got, so other people tend to push your buttons. That's good reflection. Let's see what Richard has. Yeah, and I think Richard, having been in some of my trainings before, looks familiar. So he says, you don't really see a need to make any changes, and you certainly have a right to make your own decisions. Others can't force you to change. Good. So he's got kind of a straight reflection and then emphasizing autonomy. Thank you. Heather says, I'm glad you decided to come in today despite your parents wanting you to do this. So that's kind of an affirmation, right? And there's an open-ended question related to that, Heather, that you can ask kind of as a follow-up to that. It might be sort of a refocus, redirect. Do you know what that would be? So what I would say is, so what led you to even walk in here? I mean, you actually got in the car and walked in here with me and walked in here to see me. What led you to agree to do that? So you're trying to find some kind of strengths, maybe, see what might be leading her to say that. And let's see, Billy. Let me see what Billy said. Even though your parents want you to come here today, you certainly have free will and you are here. So let's see if we can make this beneficial for you. So that would be a redirect, like kind of a reflection and a redirection, right? Refocusing. Let's see, Nadine, have you seen others defend themselves this way? How did you feel? Let me think, Nadine. Because it's like, I mean, it's not a wrong. I don't want you guys to feel like anything you're saying is wrong. It's just in terms of thinking of I wonder if Nadine, you're kind of coming from like a social learning theory, rather than a motivational kind of a theory. Let's see. That's the goal, perhaps. Let's see what else. So I had so a couple examples I had was I'm kind of doing a straight reflection with sort of an amplified, where I say, so your anger isn't the problem. Certain people at school are purposely aggravating you and you can't do anything about it. So I'm trying to like make them see, like how they sound, like you sound like you can't do anything. Let's see. So Wendy says, I can understand the need to defend yourself. So yeah, but do you ever feel like that backfires? So you want to avoid using the but, and you want to avoid a close-ended question. So instead, I could see you're just defending yourself. I wonder if that ever backfires, or how might that backfire on you from time to time, right? Or here's the other one that let's see, the B side, coming in today speaks to your maturity, good job. So Tanya's got an affirmation in there. I like that. You feel the need to react when others make you mad. Yeah, that's a good reflection. My other one is agreeing with the twist. So here's another one I thought of. So you feel justified in defending yourself against bullies. It sounds like using your anger to defend yourself works best for you, no matter the trouble it ends up costing you. So you see how it almost implies a question, like when the other one was, somebody else had it up here, when Wendy had about feeling like it backfires on you, is that I'm showing them that they're saying it doesn't backfire on them. And let's just see how they respond to it, because really good reflections prompt them to think that it doesn't have to be an actual question to prompt a response in thinking. Let's see. Jamie says, I do understand that when people push our buttons, the first thing we do is defend ourselves so they don't keep pushing us around. Let's discuss if some negative consequences may come out of this. Yeah, so you can do that. So that's directing it. And Richard Price says, sounds like one of your strengths is being able to defend yourself, right? So you can find that that's kind of reframing or affirmations, right? That you're finding something positive in it. And the idea here is that, this child needs to feel safe with you to even be willing to talk about that potential negative impact of how they defend themselves, right? So if you're understanding them, you're kind of validating what their concerns are, what their perceptions are. Then that frees you up to be able to begin to help them think about, like we said, the negative side of what they're doing. Yeah, so Sarah's got that's an amplified one. So your automatic response is defend yourself when someone says something upsetting, and you're okay with those consequences. So that would be amplified in a way, right? Although it's accurate too. So maybe it's not that amplified. All right, good. Thank you very much. All right, so I want to show you this, and I think those of you who've been in my sessions before, I've mentioned the silent man, but I don't think I've shared it with you just yet. And I apologize. I did look over my old presentations to try to make sure I didn't duplicate stuff, but I apologize if I messed up somehow. But some of you haven't seen it, so you're gonna, you get that experience. So this is just a snippet of reflection of the silent man. So this is kind of a classic motivational interview that Bill Miller, who's one of the authors, does with this guy. And the guy is not very interested in talking. So when you think about, what do I do with a client who's not only resistant, right? So they're pre-contemplative, but they don't even want to talk. That actually asking more questions tends to be the wrong move. And that you can see here, Bill Miller uses reflections really, really well. It's almost painful, but it works. And I mentioned it when I did meet Bill Miller, that I told him how much I love this one, and how amazing it was. And he said, fangirl moment, but he said, they just told me go in and do motivation interviewing. It wasn't like a targeted session. They didn't tell me what it was going to be about. He said that was hard for him to do, he said. So, okay. Thank you, Richard. Sorry about that. So here we go. Hopefully it's just the snippet of it.
John, you called up and indicated that you'd like to talk to someone here, and so I'd like to know how I might be helpful to you.
Had to come because of problems.
So there's some problems you've been having, and someone has made you come here.
Yeah.
You're not too happy about that.
I just like to take care of my own problems.
So talking to somebody else about them is hard. It's not something you're used to doing.
No.
And yet someone else has said you need to be here. Tell me a little bit about that.
My wife, she wants to she works and I work and take care of the kids together. She says she wants to go back to school, study to be a nurse or something. I don't think she needs to.
That seems silly to you.
And we're just doing okay.
You like things the way they are
Yeah.
now, and that feels like a real big change.
Yeah.
There's some things about it in particular that you don't like.
It's just everything's okay.
So why change?
Yeah.
Why mess it up? Things are going along okay, and now she wants to get some more school, some more education, and it's disturbing. It changes things.
She's got the kids, She's got a job.
She already has enough to keep her busy.
I think so, but she don't. So we argue.
You're happy with the way things are. She's not quite satisfied with how things are, and she wants something else. She wants to get some education. And that's not okay with you.
She says things will be better. I can, I can see that, I guess, but I don't. She's got plenty to do, everything's okay. She just keeps on and on about it.
It's really important to her.
I guess. Sometimes I just wish she'd shut up,
Your word may be that things will be worse if she goes back to school, that somehow it won't be as good as it is now.
Yeah, she would go back to school and, flunk out. Or she might go back to school and decide she don't want nothing no more. She don't want no family.
So one thing that might happen that would hurt a lot if she went back to school, she might decide she didn't want to be with you any longer. That's a worry.
So I like to leave it. I know it's a little bit long, but I like by the time Bill gets to that last one where he just says what the guy sort of implied, is that he, is afraid that his wife won't want him anymore. And did you see how he kind of looks up at him a little bit, where they what do you call it? Zoom in on him, and he kind of peeks up a little bit. So yeah, I'm not sure if this is 100% role play, but if not, this guy is really good. I'm not sure. So I really love the way he's able to kind of add a little bit. It almost seems a little redundant in a few places, but he's able to start to add things and help the guy feel like he can talk. So he's patient with him. He's accepting, even when the guy's like, I wish she would shut up, right? He's not judging him and just trying to help him express himself. That's really what it is, helping him express himself so that he gets more and more comfortable telling Bill what's going on. So I think that it's been a while since I watched the whole interview, but I think he does, admit that he drank too much and argued and hit his wife or something. So he's in there for some kind of domestic battery counseling. So sorry about that. Okay. So those are ways to respond to sustained talk and using reflections. So what I'm going to get into now is how do we develop discrepancy? So we can sort of reflect some of the sustained talk. So here's the deal, is that we want to be very careful with it. So if you're hearing any kind of change talk, you need to run with that. But if you find you're with someone who just isn't there, that the problem recognition is not there, excuse me, that you actually do acknowledge. So you use some kind of reflection, and then you might use one of those other strategies, about the autonomy, coming alongside or redirecting, any of those kind of strategies. Or you also have these. So when we're purposely trying to develop discrepancy, to help, the point of this is to build that problem recognition. So discrepancy is when a person's own goals and values conflict with their current behavior. So, so that's why trying to convince someone that they have a problem doesn't really work, because it has to come from within to truly feel discrepancy. Now, it doesn't mean that people who care about them don't add something to the equation, but that isn't the only thing that's gonna work. That they would have to care what that other person thinks, right? If they are, worried, for example, say a veteran is really experiencing some negative consequences because of his PTSD symptoms and maybe increased drinking. And now his wife is saying, you've got to get help, or me and the kids are leaving. So there's a certain amount of discrepancy that's already there, right? But let's say somebody's saying, I don't know what the big deal is. I just drink a little bit, hey, I was in a horrible war. What do you expect, right? So when there's those excuses, then we have to come back to developing the discrepancy. So I think I already said that, right? So then unless, a person experiences some kind of discrepancy, they're not likely to have any kind of motivation to make a change. So to facilitate the building of discrepancy, we do still need to keep all of those skills and principles in mind. So the partnership, compassion, evocation, and the whole of acceptance still applies, as well as avoiding that righting reflex, right? So remember I said for the pre-contemplators, we want to avoid giving advice, and that we're really about building trust and safety to talk about the issue. So here are the strategies. We're going to talk about instilling discrepancy, exchanging information, providing feedback, exploring others' concerns, exploring goals and values, and ultimately honoring autonomy. So one of the things to keep in mind about discrepancy is that, here's where sometimes we need our own little lesson in patience, right? That, clients often need some time, and, change is not, it's number one, it's usually not a linear process, but also that, there isn't a time limit on it. That when a person becomes ready, willing, and able to make a change, however long that takes is kind of however long it takes. Now, hopefully with us working with the client, that we get them there a little bit faster, right, than as if they were on their own, most likely. But we have to remember it's an instilling, that it's a process, that we need to infuse this. And sticking with a kinder, gentler, kind of encouraging approach is more likely to be effective. So we are there to help the person consider reasons that they might change, right? So we don't want them to feel like there's pressure to change, that I'm here to make you change. I just would like to talk about it and explore it with you. One of the things that we do to help instill discrepancy is that we can use a decisional balance. So those of you who were present for my strategies for evoking change talk, we did talk about pros and cons. Now we're going to talk about pros and cons and pros and cons. The full decisional balance is a little bit different, and you only want to do this if there is pre-contemplation. When I worked with juvenile justice, I worked with youth that were in secure care at Bridge City Center for Youth some time ago. And we developed a substance abuse treatment program for them. And this was one of the activities that we did with them. So they were often not thinking that, and by and large, they smoked weed. That was the most used and abused drug by this population. And they really just didn't see a problem with it, right? So what we would do when we are dealing with somebody who's already might be thinking about change, you're only going to ask them, how do you benefit? So what are the pros of change? And what does it cost you if you don't change? That's all you should cover if there is some change talk. Now, so I'm going to say no, that they are, these youth didn't think it was a problem at all. So what we did was often we started with the pros of not changing. So we would start down here, and we had a worksheet, and I'm gonna share an example with you. You don't have to use it, but it's just a table, kind of a worksheet thing that we made to do that. And that they would start, we would say, well, what's good about smoking weed, basically is what we were asking them. If you don't change, what's great about that? What's the benefits? What is it? What are the pros, right? Whatever language you want to use. And so we would get them to talk about that and acknowledge the benefits that they perceived, right? So we're not arguing with them about it. We're using those reflection skills. Then we would say, and if you did change, if you did quit smoking weed in the long run and you're back home, what would suck about that? Like, what's the downside of it, right? So what does it cost you? What's the bad aspects of not smoking weed, right? If you did change. So we allow them to talk about all of that sustained talk stuff first and acknowledge it. So again, this kind of goes against, normally I said, don't ask this stuff, but if it's pre-contemplation, you got to start here. Then we can get into, all right, so what are some of the downsides though? Like if you do keep smoking weed, like what's some of the bad things about it? So getting them to talk about things about their, getting in trouble with the law and having to be on probation, and now they're stuck here, right? So think about all of those different aspects of their, think of dimensions of their being, of human, like universal needs. Think about theory, y'all. So frameworks, and, think about like socially, emotionally, mentally, school, family, right? School. Think about all those systems and areas of their life and get them to think through all that. Then you lastly come to, so how might you benefit from not smoking weed? So then you start talking about that. So it's just, what ifs. Nobody's here to make you do it, right? But what if? And this was really nice to do in a group because they could sort of inform each other and kind of make it okay that we all have this discussion together and nobody's here telling you that weed is bad and you have to quit smoking. It's, what do you think? So it was a time for them to really talk about it. And once we gave them the chance to talk about their side, they were more willing to talk about, well, essentially our side, right? What are those potential benefits? Okay, so another strategy, and this is where sometimes people don't understand motivational interviewing, that it really is about the spirit of the approach and not that you don't ever give information. So now I can't remember the woman's name who does the tip of the day. Just like she had said, it's not that you don't ever give information or give suggestions, it's when you do it and how you do it. So information exchange is based on the strategy of elicit, provide, elicit. So the idea is that you ask first, what do they already know about it? So that might be one thing we do, say, well, so for example, if I was going to do some education about marijuana with these kids, I would say, well, what do you already know about marijuana? You know, what is it? What does it do to you? What are the physical effects, right? You would try to get them to kind of brainstorm all of those facts that they might already know. Now, it isn't time to argue with what's accurate or not accurate. You just go with it, right? Just here's the possibilities, right? See what they know. Let them be the expert, right? Then you can respond by providing an affirmation of what was correct, right? So you have this, and that. That's great. You know that. That's that's accurate. I have some additional information that's a little bit different than this that you might find helpful. So sometimes what I do, because Dawn, that's her name, Dawn was saying that we're supposed to always get permission. Can I share that with you? I find that I imply it. I don't know, this is just stylistically that I might say, I have some other stuff I could share, and I sort of look at them like, is it okay? And then if there's like, yeah, sure, whatever, then I proceed. So I think to me, it kind of depends on the client and whether you need to get explicit permission and say, do you mind if I share it with you? So if they're seemingly like maybe very defensive, I probably would say, do you mind if I share that? Is that okay with you? So getting permission won't hurt, but there's kind of a way to do it. So then after you share the information, then you ask what they think about the new information or what their understanding of it is. So what do you think about that? How does that fit? How does that fit for you? Things like that. So process it basically, right? You don't just say, do you understand that? Does that make sense? Which I'm totally guilty of doing. I'm terrible about it. But, trying to ask them, so what do you think about that? Or how does that fit? So that's where you can definitely share information. Group session. Sorry, Margaret has a question. What would be the approach to share information in a group setting? Yeah, so that would be, so my example really was based on my group work experience, which was to ask the group, what do you know about marijuana? Or what do you know about depression? What do you know about anger management, right? Whatever it might be. And then, so I might like brainstorm that with them and then say, here's what, yeah, this is correct, and affirming what was right. And then saying, okay, I think there's some other information that we're going to talk about that you'll find, I think you might find helpful. Is that okay? Or are you ready for us to start group, for example? You might do that, or what do you think about that? There's something else I was going to say, but you can obviously also do that one-on-one, talking about maybe you need to refer a client to inpatient, I'm trying to think of another example besides addictions. Help me out here. Maybe you're working with a family who just got, you just got involved with DCFS, never been involved before, and it's looking more like they probably just need some parenting classes, but they're not really understanding what the problem is. This is the way they've always done it, right? That kind of thing. So that might be, well, tell me, what do you know about parenting? Like what are we supposed to do as parents? What's the role of a parent? So you ask them first, and then you follow up with, yeah, this whatever's correct. And then when you need to provide the information, then you say, there's some other important roles that we found are relevant, or whatever, however you want to say it. Can I share that with you? So I might, with that family, do the permission explicitly, and then share maybe a few more points. You want to keep it kind of succinct. And obviously don't use a ton of lingo, but share a few more things and say, what do you think about that? How does that fit with your approach? And just kind of using that to process it. Let's see, Jane says, for example, risk for postpartum depression for someone not on meds but has bipolar. So maybe they're at risk for it just based on their history of bipolar illness, and they're not on meds, maybe because they've been pregnant, and now they've given birth, and now you're thinking they're going to be at risk for that. So tell me what you know about postpartum depression and what your risk is for it, right? So you kind of start off, does that make sense? You start off that way to let them be the expert first. So I have a piece of a video. So this is a juvenile probation officer who's with her youth, a female youth who is not following the curfew rules. So I want you to see what she does, and if you're able to take any notes nearby you, what do you think she did well, and what, if anything, do you think she could have done differently to better fit motivational interviewing? Okay. I think I'll just do it like this.
Start off by getting a little bit from you tell me about your understanding of curfew.
Well, my mom gave me a curfew of 10 o'clock, and I think that this probation is just kind of silly, like, because she says it's fine, so I don't see what the big deal is.
Okay. So part of it has been that sort of your mom says it, and, she's your parent, so that's what you've been listening to.
I guess.
Okay.
Yeah.
Okay. So I might offer a little bit of information, because this might have been where we had some of the miscommunication before. Is when someone's on probation and there's a court order that your curfew's at a certain time, actually what the court says sort of goes before what the parent says. And this could also be something that your mom didn't understand, so I'd be glad to talk to her about it too. So basically when the judge said, Haley needs to be in her house by 8 o'clock, that's sort of what goes. So when we call you at 8 o'clock, and the couple of times you haven't been there on the curfew check, then sort of we mark it down as you not following through on what the judge said. And I don't want that to cause you problems later. And I'm sure your mom doesn't want that to cause you problems later. So having heard me say that, why don't you tell me now sort of what are your thoughts on this? What's your understanding of your curfew while you're on probation?
Well, I know that I have to be in by 8, so no more parties, I guess.
So given that, this 8 o'clock, tell me about some of your strategies for getting home at 8 o'clock.
Well, I could set an alarm on my phone, I guess, like we said, for getting to my classes, so, I mean, or I could write it down.
Two really good ideas there. So use your phone or write it down, sort of like you're going to do to help remind you of group. Both of those sound like good ways, and you could start that right away.
Yeah.
Okay.
Of course.
All right. So what do you think that this interviewer did well? Do you remember what the first thing is that she did? She did use reflection, yes. So when the girl explained her perception of curfew, she did reflect that back to her. Partnered with the client. She did ask the girl for some ideas about how she could comply with curfew, right? Discuss some options. She did ask for the client's understanding and provided factual, non-judgmental information. Yeah, so she did provide the information. Was empathetic and supportive. So what do you think she kind of missed? So thinking about a motivational interviewing approach, what do you think maybe she could have done better? So yeah, I know it's going to bug somebody that she didn't pursue the comment about parties, right? So if she directly addressed that, I think she is going to come off as confrontational, and the girl is already a bit defensive, right? But what does her comment about the parties tell you how she feels about the curfew? Does this girl really, really want to follow the curfew? Okay, Jane, I like that. So Jane says maybe she could have asked her to provide some additional information to clarify the reason for the curfew. Yeah, so maybe kind of ask her, and why do you think curfew, why is it important? Why do we impose this curfew on you? What's the purpose of it? Exactly, which really gets at really gets at her investment in following the curfew. So I felt like it was very rushed. And like I said, I only showed you the snippet, but she actually talks with her about 2 or 3 different concerns. The first, I think that was like the second one. The first one was she asked her about, because she missed some kind of group sessions, and kind of followed that same pattern of, why is, what happened? How can you get to group? So she's partnering with her, but she's not getting at the importance and the girl's confidence. She's missing aspects of motivation. So she's assuming that because the girl understands curfew, that she's now going to follow it. So I think that Jane's point is absolutely on target. That what is the reason for the curfew? How would you benefit by following the curfew? And what do you think those costs are? She said there'll be problems down the road, but what are those problems? What does it cost you to not follow it? Darlene feels like the statement about the mom not understanding the rule could have been taken offensively, like, oh, you think my mom's an idiot, right? Is that what you're saying, Darlene? And yeah, okay. And Cassandra is saying doesn't make sense and is not invested, right? So we don't really have this girl invested in doing better yet. So we want to ask her questions about how this would benefit her, and what's going to happen if she doesn't. And actually, there is a little scene, I did miss that too, at the beginning. She asks her kind of what she wants to do, and the girl talks about wanting to like go to nursing school or something, but she fails to tie that back in. So she's getting at, what are the girl's goals and what does she value, and how does being on probation affect that? So these are things you want to do. How does following curfew get you to that point? So there's some kind of linkages missing there. Very good. So I just provided kind of my assessment summary here, that these were the strengths that she did, and then that she provided information without permission. She did use the words, she said sort of a lot, and that really discounts and minimizes what she's saying. I know we tend to do that, and I'm guilty of it, I'm sure. So we want to avoid doing that, especially when you're talking to like a client that's in that sort of, not just legal, but just a structured kind of thing, that the rules have to be clear, that you don't want to use sort of. So I missed that I talked about missing eliciting importance and confidence. And then she also didn't ask what else. So at the end, when the girl says, well, I guess I could put it in my phone. And I can't remember what the PO said next, but it was like, maybe put it on a calendar, and you can do that right away. Like she gave it to her. So instead of saying, what else can you do? Or what would help you follow through with this, right? So she kind of missed some of that, kind of rushed. I felt like she kind of rushed through it, which is what we tend to do. I mean, I've been guilty of that too. But it really is not in the best interest of our clients' progress for us to rush through some things. All right, so another strategy is providing feedback. So, so that other one was really more about giving information and then maybe going over suggestions, right? Providing feedback has to do with giving either subjective or objective data. This can come from, like, for example, assessment tools, and that we can go over that information with the client. So, for example, when I worked in juvenile justice, we used subjective data. So that means it's from the client's self-report. So I'm not putting words in their mouth. This is how they answered it. And so I try to emphasize that when I go over it with them, like, so based on how you answered this, you indicated these are your consequences from either alcohol and or drugs. So it's an alcohol and drug use consequences questionnaire. And then there was an inventory of drug taking situations. So based on what you wrote, these are the situations you're most likely to use drugs in. What do you think about that? So kind of still use that elicit, provide elicit-ish kind of approach. So the idea isn't that you're there to say, look how bad it is, right? It's trying to be as objective as you can about it, to say, here's what the feedback is. What do you think about it? So the idea is to make them ambivalent where they're previously not. I was trying to think of another example that, that objective data might include like health information. If you work in, like if you're do medical social work or some other kinds of healthcare, that, having information about blood pressure, glucose numbers, weight. I said blood pressure, did I say glucose? It's like, what else do I have on here? Liver enzymes, right? So based on this, somebody who, or even somebody in dialysis, what their, like their kidney functioning and that kind of thing, that, you say, here's the latest levels. What do you see? What do you think is going on here? This one's kind of elevated. What's that about? So you discuss it with them. You don't just throw it at them, right? So that would be objective data that can potentially be used. Have any of you used anything like that? Do you use any kinds of assessment tools and go over the results with the client? Just out of curiosity. There is a tool for measuring kind of motivation but it's related to alcohol or drug use, the Socrates. That's another one that we used as well. Not really? You don't use any tools? That's okay, just asking. Or you don't feel like answering, right? All right, so here's another suggestion, is to explore others' concerns. So remember I said that we can't rely on the pressure, like peer pressure or pressure from somebody to make the person change, but it can be a source of discussing potential consequences, building on their goals and values. So do they value that person's opinion? Do they value what they're concerned about? So you want to get at, what are other people concerned about with regard to your behavior? Oh, thank you, Connie. Connie says, yeah, the PHQ and the GAD. So the PHQ, you're telling them sort of what it's indicating, right? And then you kind of see what they want from there. It's been a while since I looked at that. Oh, and the generalized anxiety. The GAD is the generalized anxiety one. It's been a while since I looked at those. Yes, okay. So identifying, so thinking about some of the important relationships they might have. It doesn't have to be family. I mean, it could be the judge or the child welfare worker, but somebody who has some knowledge of their behavior and are concerned, that you can say that. So it would be, well, why do you think the judge referred you to this? What do you think he's concerned about? Or what do you think your child welfare worker and the judge are thinking about this situation? What causes them to be concerned? Or what about your mother, right? So, and then using that, you kind of are asking them, what do they think? And then using reflections to kind of follow up and help them kind of think it through. So I have a very brief example. So I have the video of it. That's my daughter and I, so please excuse the poor quality. Hopefully you can hear it. But I did include the transcript on the following slide. So you will have that to look at as you want to. And yes, we're reading the script. So why do you mention your mom is worried about your drug use? What do you think concerns her?
She's someone who always goes down on the safe side of every issue. But my drug use is my choice, and it's none of her business.
She doesn't want you to take risks.
That's definitely true. She doesn't like anything that is seen as remotely risky. And I guess that she thinks my drug use is risky.
Why do you suppose she thinks that?
Well, for one thing, it's illegal. She's worried that if I get caught and get in trouble or go to jail or something like that.
But that's really none of her business.
I know. Now there I can see where she has some grounds for concern, going to jail and all, that would affect her.
So if it could affect her negatively, it's reasonable for her to worry.
Yes, I guess so.
But if it's affecting just you negatively, then that shouldn't be her concern.
Well, she'd worry about that too.
Because
she cares about me. She's our family smoke alarm.
So wherever we might go from there, so essentially, getting her to think, well, I guess she has a reason to be concerned because it's illegal. She's worried I'll get caught, get in trouble. I'm just using reflections in there to see, where she's going to go with this. Because she says, that's really none of her business, right? But, I guess I could see where maybe she has concerns. It would affect her if I went to jail. But if it's affecting you negatively, that's not her concern. Well, she'd worry about that too. So he's like saying, yeah, my mom would still worry, even though I think it's none of her. Oh, I'm sorry, I forgot to open that. Even though, I don't think it's any of her business, she's still going to worry. And then now we have this, well, why would she worry? I said, because she cares about me. She's our family smoke alarm. So that might be an interesting thing to kind of get into, and kind of talking about that. Like, maybe mom is right. If she's the smoke alarm, is she right about detecting, where there's smoke, there's fire, right? So those are potential ways we might get to use other people's concerns to help the client become more aware of the problem, right? And then we have exploring goals and values. I think we just have this one and one more. So this one, if you were in the eliciting change talk, this will look familiar. So this is one that we want to use anyway. In motivational interviewing, this is a great strategy because it can help solidify a level of importance and commitment to the change. And as I mentioned about discrepancy, unless the current behavior conflicts with one's goals and values, there's no motivation, there's no impetus to make a change. So we want to make sure that as we're interviewing, that we are identifying what their values are, what's important to them. So we don't have to use the word, what do you value? It's just about what's important, whether it's family, keeping a job, right? What is important to this client? And why is it important? What makes that so important to you? And then how can you essentially be even more true to this value? How you want to put that is up to you. And I do have a worksheet that I will send that looks at identifying values. And then in my book, I have an activity to help clarify the values that basically asks these types of questions in a worksheet. So if we took a healthcare situation, so a 60-year-old male, he has diabetes and hypertension. The target of the health counseling is that he will develop better eating habits, and we'll know that AEB, meaning as evidenced by reduced A1C levels and reduced insulin dose. So if I asked him, what do you value? It sounds like family is really important to you. Tell me about that. So they need to describe that. So he might say, well, I love my wife, my kids, my grandkids, right? Family is really important to me. Blah, 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 right? I use short sentences for the sake of space, but hopefully he would expound on that, right? So what actions does he do that support the value that his family's important to him? And he says, well, I like to cook them red beans and rice on Sundays and maybe whatever else, right? So what is the impact of his current behaviors on the value? So his current ways, impact of his current behaviors, not just the cooking the red beans, but his overall eating habits, right? How does that impact his family, whom he values? Well, he says, they think I don't take care of myself right. Maybe I shouldn't eat those red beans and rice. And then if you made the change, how would you impact that value? Well, I could have more good days to spend with them than bad, right? So he's identifying the benefits of making a change in relation to his value, right? So what is his goal? So I told you what the health counseling goal was. What do you think is his goal? I'll go back to here. What's his goal? Time with family. Yes, thank you, Heather. Yeah, that it's his goal is to be able to have more time with his family, that he needs to feel better. It's partly like being healthy enough to participate with the family as well as days of living, right? And how does, if he does honor that value, if he does work on his better eating habits, then how does that help him meet his goal? So that would be him improving his health so that he feels well enough to spend the time with them, right? I guess I already kind of said that. And what was my last question? And then how does not targeting his eating habits, so if he keeps his status quo, how does that interfere with his goal? So logically, right, then it's kind of the inverse, that he may struggle. There's days, maybe he can talk about days that he couldn't cook the red beans and rice because he felt too unwell or he was in the hospital, right? So you just try to get them to kind of think about those different aspects of goals and values and in relation to the current behaviors. All right. And then lastly, honoring autonomy. So this is the coming alongside that I mentioned earlier in the sustained talk strategies, right? So as I've mentioned, this is a last resort, that after you've tried all of these things that I've talked about, right, that at some point they are still very adamant in not changing, then we have to do that paradoxical approach and just say, I recognize that you're not at all interested in stopping smoking now. If anytime in the future you're thinking about it, the door is open and I will be glad to talk to you. So this is not with the twist, right? This is so it depends on what you think is going to be most effective. But I would say if you really are thinking that we're going to have to wrap it up, that they're not going to come back. Or sometimes, like I trained some health coaches, and they would do, like, the participants didn't have to change. They just needed to answer the phone and be on the phone with the health coach to target smoking cessation. So their insurer, knows their risk, they're higher risk to cost the health insurer because of their smoking. So, but they don't force them to quit smoking. So they have a sort of curriculum that they go through. So they do try to engage them and ask them, what do you want to work on? How interested are you? They use some motivational interviewing, but at some point they do information. So there's an informational component. And at the end of the series, the person may still say, I still don't want to quit smoking. So this would be appropriate to say, I recognize that you're still not interested in quitting smoking, but when you're ready, we're here for you, kind of thing. So at that point, you would want to use more of a come alongside rather than just saying, well, despite knowing all of the negative risks, right? Or you could say, despite knowing all the risks, you still choose to continue. However, we are here for you when you change your mind. So leaving the door open just seems a little bit more positive, right? So change tends to occur when that person really perceives a discrepancy. So how, like, sometimes people will, there's those external factors, right? That I want the PO off my back. I don't want to go to jail, so I'm going to quit using for right now kind of thinking, but I'm not necessarily committed to it in the long run, right? So that's still a discrepancy, but it's not likely to get to lasting change, right? That's a starting point, but that doesn't mean that they're going to ultimately commit to the change in the long run. Another thing to think about with this discrepancy is that it kind of needs to fit the Goldilocks principle. It needs to be just right. So if the discrepancy between their goals and values and the current behavior isn't big enough, that can mean there's not much importance placed on it. So it doesn't mean they don't recognize it. It just means it's not that. Like, for example, somebody who's 5 pounds over their ideal weight, that's not really a whole lot, and they might not feel that motivated, depending on how they perceive that discrepancy. But and then on the other hand, if the discrepancy is too large, that can also be very self-defeating. So if somebody has 100 pounds to lose, for example, that might just seem like it's way too much, and just feel that, demoralized kind of feeling, like there's just no way I could do it. So trying to find that discrepancy, that how do you help a person, the developing discrepancy that I just talked about really focuses on the person who thinks it's too small. And how do you make it seem a little larger by getting them to look at the potential consequences and education and, all those different aspects. The one who sees that it's too large, then that's an issue of hope and confidence that I'll talk about next month. So we can still use a variety of those motivational interviewing strategies. As you can see, other than the decisional balance, we're really not eliciting sustained talk. That's the only time we're really eliciting the same sustained talk. That the rest of the time, we're actually trying to help provide we're trying to get at some discrepancy. So providing concerns, helping them identify what might be concerning. Okay, I hope that helps. Any questions? I think we have just a couple of minutes if there are any questions. And as I mentioned that here, let me also send out the handouts again. But on the last page of the handout is my website, my Facebook page, and then a link to my, if you want to order my book. It's officially on sale tomorrow, but it's also available as an ebook if you prefer that. So hang on here, let me give you all a couple of things. I don't know if I can do more than one at a time. No, I can't. All right. So I'm going to send you the decisional balance. So that's the 4, like a Johari window. So the pros and cons, pros and cons. I have, what else do you guys need? I was going to give you the values. Here it is. Here's the values, identifying values from my book. So it's an excerpt from my book. And I will give you the PowerPoint as a PDF. It's kind of big, so if you have trouble downloading it, Lindsay is going to be posting it as well when she puts up all of these videos on their page. Lindsay also included in the chat box a link to register for the Building Hope and Confidence session, and that's next month. I think it's, and y'all don't remember what date, the 16th maybe, or?
Yep,
You know?
on November 16th.
16th. I wanted to make sure it was a little bit far away from, what do you call it? Thanksgiving. I didn't want to do it too close to Thanksgiving.
Yeah, of course. And Margaret asked about sending the links through email, and yes, we will make sure to include the links and the documents that Dr. Wood shared through email. Just make one final reminder. I think we have 2 or 3 people who called in by phone. So if you want to receive CEUs, just email me your name. Otherwise, the system won't register your phone number. So just let us know that you attended. Dr. Wood, do you have any information about the Building Hope and Confidence session that you'd like to share?
I will talk about, so I'm trying to remember what I'm going to do in that one. Yeah, so we'll just talk about some of those strategies. Some of it overlaps a little bit with the strategies for eliciting change talk, but we're going to focus on eliciting confidence talk and just kind of how to build strengths, and also looking at finding hope. So some suggestions, and some of that, you know, a large part of it is from the Millen Romnick book. That's what I largely base what I'm doing on. But I am going to look up some more information, additional information about building hope. And I do have some exercises from my book that apply to building hope and confidence that I'll share. All right, any questions, anything else? All right, well, I appreciate everybody attending. And those of you that chatted, thank you.
Yeah, thank you so much, Dr. Wood, and thank you everyone for attending. We will follow up by email and make sure to register for our final Motivational Monday on November 16th. Have a great afternoon.
Hope to see you then. Thank you.